High dose rate HDR brachytherapy. Radiation therapy is one of the most common treatments for cancer, and with recent advances in technology, many kinds of radiation treatment are available based on the person's cancer type and location. High dose straight brachytherapy is a type of radiation treatment that allows physicians to deliver high doses of radiation to specific areas of the body from the inside the body rather than through conventional external radiation beams. So, what is HDR brachytherapy? In order to specifically target the tumor and minimize radiation effects on surrounding tissues, the physician performing HDR brachytherapy inserts an applicator device with small, hollow catheters, wires or needles directly into the tumor site and then inserts a series of radioactive pellets into the device. Guided by a computer, the radiation oncologist and physicist can control how deep the pellet goes into the device and how long it remains in place in order to deliver the appropriate amount of radiation to the target site. This type of radiation is faster and more effective than conventional radiation for some types of cancer. This can be performed on an outpatient basis and maybe produce fewer side effects. What can HDR brachytherapy accomplish? HDR brachytherapy allows the radiation oncologist to deliver intense levels of radiation directly to a person's cancer site. In eligible patients, it can be delivered in a much shorter course of treatment than standard radiation therapy. It is used alone or in conjunction with other treatments for many types of cancer, including those affecting the bile duct, brain, breast, cervix, uterus, esophagus, eye, head and neck, lung, pancreas, prostate, rectum, skin, soft tissue, or vagina. HDR brachytherapy can deliver targeted radiation to tumors, sparing surrounding tissue from radiation damage. Offer treatment that takes only a few minutes over a period of days rather than the 5 to 7 weeks often required for conventional radiation. Cause fewer side effects, helping people return to normal everyday activities faster.
So, what are the expectations during the procedure? HDR brachytherapy is usually performed as a short series of outpatient procedures outside the hospital. Though treatments for certain types of cancer may be performed in the hospital, depending on which part of the body is being treated, you may receive local anesthesia to numb an injection site, sedation, or general anesthesia if catheters must be implanted. For certain HDR brachytherapy treatments, catheters, tubes, or wires that transport the radiation source can be inserted through needles. Treatments take only a few minutes, and then the radioactive source is removed from your body. Applicators may be left in place until you've completed all treatments, or they may be removed after each treatment. Radioactive material will be inserted into the brachytherapy applicators with the help of a computerized system. Your radiation therapy team will leave the room during your brachytherapy session but will observe you from nearby. Most people undergoing this therapy feel no pain during the procedure. For recovery, most people undergoing HDR brachytherapy can return home after treatment. Once the radioactive material is removed from your body, you won't give off radiation or be dangerous to other people. In most cases, you can return to normal activities right away. You may experience some tenderness and swelling in the treatment area, temporary tiredness if you require sedation, or other side effects depending on your treatment treatment site. HDR brachytherapy typically causes fewer side effects than conventional radiation. HDR brachytherapy possible risk. Risks associated with HDR brachytherapy are typically rare or minimal. Side effects of brachytherapy are specific to the area being treated because brachytherapy focuses radiation in a small treatment area. Only that area is affected. When they do occur, they depend on the treatment location and may include bladder irritation, bleeding, bruising or swelling, diarrhea, erectile dysfunction, fatigue, infection, mild cramping, numbness, sore throat, and trouble urinating or painful urination. And that is our report about high dose rate brachytherapy. Thanks for listening. Bye bye.